Mm. So the proportions of children with injection site reactions after receiving Influenza in the second RSV season were comparable to what we saw in the first season for infants who either received Influenza or palivizumab in that first season. In terms of immunogenicity, what you're getting at there is antibodies developing against Influenza itself, right? And those proportions remained low in the second season of SMART. We're working on extensive analyses in this vein. They're underway, and we're looking forward to presenting them at a future conference. So that's exactly right. An additional 105 milligram dose of Influenza is indicated for infants undergoing cardiac surgery with cardiopulmonary bypass, or entering their first RSV, when they're entering their first RSV season, as soon as that infant is stable after surgery. And that's because antibodies from a first dose that was received pre-op may be removed from the infant's circulation, potentially necessitating that redosing post-procedure to ensure durable protection against RSV disease. When answering your question, it's important to bear in mind that infants in the SMART trial who had successful corrective surgery for CHD prior to their second RSV season weren't necessarily eligible to receive Influenza in that second season for the very reason that they'd had successful corrective surgery. That said, we do have a few participants that underwent that second season redosing, and we're in the process of analyzing that data. Yeah, I probably should have mentioned this earlier, but to make it clear to your viewership, SMART provides us our second season data, but at this moment, Influenza is not currently indicated for that second season dose. We will be moving forward with filing for a supplemental second season indication, but I do want to make it clear that we're not currently indicated for that second season right now. So when when the indication is expanded to the second season, which we're hoping for with our filing, we're going to encourage pediatricians to administer the product based on that approved indication, as well as the recommendations that will be coming out. To focus on supplies specifically, here at Merck, our colleagues and various teams have been working really hard to ramp up manufacturing efforts for many years now, and we're super confident in our ability to supply the US market and meet US demand. That's really important. It's part of our commitment to clinical and public health. So we're proud that Influenza is going to be one of the options for RSV prevention, and we're looking forward to its potential to help reduce the burden of RSV disease in infants with a really secure supply chain behind us. Yeah, your viewership is pediatricians, and pediatricians know this better than you and me. RSV remains the number one reason why our infants are hospitalized every year, right? And with Influenza, we are super excited to have an important option that can help protect infants and reduce that burden of RSV on babies, on families, on pediatricians and their offices, as well as healthcare systems. And we can do that because we have a strong efficacy and safety profile for this product. We've been talking about the SMART Season 2 results that were just presented last month at an RSV Global Conference. And that's part of our commitment to continuing to advance the research supporting Influenza. It's an exciting moment for RSV prevention writ whole. And Celeste, thank you so much for the opportunity to talk about our data.